You can now see an involvement of the medullary cavity that couldn't be seen on X-rays, and the corresponding MR here on T1 and T2, where there is no doubt. It's absolutely 100% malignant here on this lesion. And this was an Ewing sarcoma. Just a few words about the Ludwig classification. It's really helpful when it's to describe a lytic lesion, and it's related to the aggressive potential of the lesion because of the growing speed. So it's really helpful whenever you want to describe. Basically, the first stage, first A, is a well-defined lesion with sclerotic margin around, which is absolutely benign, and it goes then from benign to malignant, and at the end, on stage 3, it's permeative lesion with the whole lesion involving the bone. Another pattern could be described for malignancies, which is osteoformation, like here in this example. Here you have two different patients with different lesions. One of them is benign. I just want to show you that it's not because you have bone formation. Bone formation doesn't always mean malignancy. So do you have an idea of which one is malignant? On the left, of course. So here you have the classical bone formation involving the medullary cavity with sunburst appearance and common triangle here with the soft tissue, a mass within the soft tissue. Here it was hypertrophic callus in a kid having osteogenesis imperfecta. So whenever you have atypical or suspicious findings for a bone tumor, you should go further on and have a CT or MR, or better, if you can have both of them really quickly. You gotta know the main differential benign diagnosis here, especially infection, that could be really tricky. So additional imaging, CT is really helpful to assess the cortical involvement and to analyze the matrix or chondroid or osteoid matrix of a lesion and to describe other features. Also, it's really helpful for surgeons to schedule the surgery and to know what kind of prosthesis they're going to put to the kids after, so it's really helpful. MRI is most sensitive because of the edema and the bone marrow changes, and also because of the soft tissue involvement. Nuke studies are also helpful, but it's part of it global general assessment, but it shouldn't be used on the first plan to characterize a bone tumor. So track number 3 will be about the interpretation of MR and the misleading findings. You shouldn't underestimate a lesion because of an insufficient study. Whenever you want to study a tumor, you got to be aware of the possibility, like here in this example, on these T1 weighted image of the skip metastasis. This is often found in osteosarcoma, like here in this example, and you should study a large area. Overestimation is not good though, and just keep in mind that the height of the tumor must be measured on T1, whereas the extension is better seen on T2. But you got to be aware of also the edema that shouldn't be taken in account. Here is another example of tricks on MR. I showed you a couple of minutes ago an example of fluid level. This is another example of a huge mass here that we can see that involves the cortex and that grows to the soft tissues with fluid level. But here you can easily see the involvement of the medullary cavity that you can see here. And even if we have fluid level, it's not pathognomonic at all of ABC. This was a characteristic example of telangiectatic osteosarcoma. So So studies, also MR studies involving the spine are really tricky too, because whenever you have a tumor, a malignant tumor of the spine, you often have a late diagnosis, or you diagnose the lesion when you are having a compression, especially medullary or radicular compression. So it's really tough sometimes to say, like here in this example, if the lesion was starting from the soft tissue and growing to the canal, or the contrary. So sometimes it's really tricky. The main helpful sign is the age of the patient. Like here, I put you the main differentials. Whenever you're dealing with a 5-year-old kid or less, you should always think about the possibility of a neuroblastoma that grows to the adjacent structure. Soft tissue tumors can also mimic malignant bone lesions and spread to the adjacent bone. So these were 3 different examples of pretty similarly looking lesions of both soft tissues and canal. Okay, so whenever you're facing a malignant bone tumor, the first thing to say is to call an oncologist or a specialist in malignancy, especially specialist in kids if you can. It depends on your institution, of course, but it's better if you can. So never try to biopsy on your own a lesion, because it could be worse than ever. So just only a few words about therapeutic. So basically for osteosarcoma and Ewing sarcoma, you're going to start with a chemotherapy to decrease the height of the tumor, and then move to a surgery, extended and block surgery. And then you're going to have adjuvant chemo, and sometimes for aggressive Ewing sarcoma, you're going to have radiation therapy too. So it's pretty heavy for a child. So the final step will be the bone biopsy. So this biopsy should be scheduled with your favorite surgeon that you have to call. So if you're lucky enough, you'll be able to call your favorite doctor from Grey's Anatomy. Sometimes it's not really easy because surgeons have a lot of work, but you need to call them before, because the biopsy tract will be removed during surgery. So you have to discuss with them. Always. So insist and make the decision with them. But radiologists are really helpful for them too, especially in difficult areas like spine or chest. And biopsy should be performed under CT. And when you have to focus, when you have heterogeneous lesion and you want to focus on the tissular portion of the lesion, you should do it. So that's it. And then your next friend you have to call is the pathologist, because especially in bone tumors, pathologists need all the imaging clues to make the right diagnosis. Sometimes it's really tricky to make the perfect diagnosis, and they need to have some information about the features and X-rays and MR. Each assessment must be also general, including PET-CT. PET-CT is mostly useful for the metastatic status.